Thank you. Yeah, I'm with you.
Hello, good morning, Miss Yousra. My name is Dr. Miftalawal. How are you doing today?
I'm doing great. Thanks a lot for asking, but I'm a bit tired. That's why I'm here.
Uh, could you tell me more what bothers you and why you're not feeling well today?
I don't know, doctor. I've noticed swollen glands in my neck over the last several months. They weren't so much painful, and I didn't think that they would bother me. However, I noticed that when I drink alcohol, they became like a bit painful and my armpits became sore. So I checked the internet and I found that it might be some symptoms that suggest Hodgkin's lymphoma, which is a type of cancer, as you know. I'm very worried about having or developing such a type of trauma.
Oh, thank you, Miss Yousra. So I would like to ask you about beside the pain that and discomfort that you feel. Have you noticed any recent weight loss or fatigue with the pain?
Yeah, I believe. Actually, I don't weigh myself that regularly. Okay, and I don't keep up with my weight uh, um, scale. So I don't know, but everyone around me tells me that I've lost weight. I believe so.
And how about your sleep? I mean, have you experienced recently night sweats?
I believe that I've noticed some sweats while I'm sleeping, and I also noticed that after drinking alcohol. So, you know, I'm a bit worried. Is it like suggesting Hodgkin's lymphoma, as I stated?
Well, Ms. Yusra, no, Hodgkin lymphoma that first, I mean, I would like to ask another question if I may. Do you have a family history
Mm.
of Hodgkin lymphoma?
No, I have no family history of it.
Uh, Thank you. I would like to ask you to allow me to have an examination so we can determine, I mean, what could be associated with the pain that you have.
Like what? I didn't get that. I'm sorry.
Uh, uh, just to, if you allow me to examine you to make
Yeah, yeah,
sure.
please.
Okay, thank you. Uh, Thank you, Ms. Yusra. I would like to reassure you here that from the examination, I mean, it wasn't revealed a large spleen or liver which could be associated with Hodgkin lymphoma. So from examination, you usually have the history and the examination, and from your history that you mentioned, the symptoms and the examination, I reassure you that uh, doesn't go along with Hodgkin lymphoma, but it's more of lymphadenopathy and
Mm.
cervical nodes themselves in your neck. So, do you know what
Okay, so
lymphadenopathy?
can you please tell me about the lymphadenopathy and if it's a type of cancer or such a normal condition?
I reassure you again that it's not about the cancer. It's most likely caused by an infection, either bacterial or viral. So it's not going with Hodgkin lymphoma that from your symptoms and examination. And secondly, I would suggest that if we can have blood tests to see it's a complete blood count and other investigations to see what might be the cause of this susceptible infection.
Mm.
Ms. Yusra, I mean, do you have any other question regarding this?
Doctor, I'm still a bit worried and I don't actually get the condition of mine. I want to know exactly what is causing the lymphadenopathy that you've stated and whether I can cope with it or do I need surgery, you know?
Well, I mean, from your symptoms, from the sign in the medical examination, it goes more with the common cause of lymphadenopathy. It could be an infection. So that's why I suggest that we go through a blood test to see, I mean, if it matches with your symptoms and the examination. Because with the examination and the symptoms, it goes with lymph node infection that causes the swelling and the increased size of your lymph nodes.
Hmm. Okay, doctor. So what should be done now?
Well, for now, that we go through the investigation, and once we have the result back, I suggest that we refer you to a specialist, uh, so we can have a more experience or opinion about your symptoms and your sign.
Hmm. Okay. But
Yeah.
don't they have any side effects?
Well, so far, I mean, it's medical investigation, so we haven't conducted prescribed the treatment yet. So it will help us to know what causes this infection.
Hmm. Okay.
Ms.
Maybe
Yousra,
some.
I mean, do you have other concerns? Have I made? I mean, have I addressed all your concerns and questions?
Yeah, doctor. Thanks a lot for your help. Appreciate it.
Thank you very much.
Okay. So, تمام يا دكتور ممتاز يعني ما شاء الله رائع أكتر من رائع more than perfect. A little bit of hesitation during the call but you did very well.
Thank you.
You're welcome. Keep it up.
Ms. Yousra, just
Mhm.
question.
Yes.
يعني ال weakest point يعني things to improve يعني from
Just
what you know.
the بص حضرتك كمان لما بتعمل question بهاف أو has ما بتحطش الverb اللي بعديها في الpost participle.
Okay.
Uh, ف just make sure that whenever يعني مثلا you have I addressed your questions have I addressed have I answered have you developed تمام لما بتيجي بس
Okay.
have في الأول بعد كده السبجكت بننسى نحط الverb اللي بعديها في البوست make sure that it's in the post this is first second a little bit of hesitation won't harm but if you're hesitant with me you will be more hesitant in the real exam تمام ف just I want you to control that although it's not harmful by any mean with that rate يعني
Okay. شكرا. Thank you.
so again it's card 41 February 15 card 4 يلا بينا
Okay. Hello. Hello, Miss Yousra. How are you today?
hi doctor actually I'm not doing good at all
Did you have good sleep last night?
no
Oh, I'm so sorry to hear that. Can you tell me how are you doing?
actually doctor the rectal bleeding that I had, of course, irritated me. And on discharge, I was told to consult a doctor, but I was given no further information regarding my diagnosis or my future prospects. I'm extremely worried that the condition was not so much clarified to me, and I know nothing about it or how to cope with it if it happened again. So, can you please tell me more about that?
Okay. Sorry, Miss Yousra. Time out, please. Just one
No, no.
question. The card says that thought that the patient is being discharged. I'm just following up on in the hospital ward. That's what I understood from the card. It seems like I misunderstood.
Not a problem. If even if, just respond to my question.
Okay, just a different introduction will be applied if it's
Yeah, but
if.
if it happened already, so just forget about it and go with it.
Okay,
That's it.
sure. Okay.
تمام. يعني
Uh,
don't irritate yourself by such a misunderstanding يعني.
okay.
عادي. It won't affect the card, but what will affect the card is you not knowing how to deal with it.
Okay. Sure.
تمام. That's it. يلا بينا.
Okay. Shall we continue or we start over?
Yes, we shall continue.
Okay. Dear Yusra, I just want to reassure you that your condition is really stable now, and you have passed the hard phase of it. I would like to tell you that your report tells me here that there were no perforation, there were no abscess, there was no abscess, and they couldn't find any inflammation. So this is a very good sign in your condition. So I would like you to just uh, be more optimistic and try to deal with it. And please, if you have anything that you don't understand from what I said, please inform me.
I just don't get it, doctor. Like, if I have another episode, how can I cope with that, or how can I act? You know, I'm
To be honest,
extremely afraid that I might develop another one anytime.
yes, yes, Miss Yusra. To be honest, I would like to tell you that it is very possible for this condition to recur. So you have to put this possibility in
Hmm.
front of you, but it mainly depends on the way you will start dealing with this condition. You will have to modify your lifestyle, your diet plan, and it is mainly going to be depending on how you react to this condition. So if you would like me to explain more about this, I would be happy to do that.
Yes, please.
Okay. First of all, it is a condition related to an intestinal problem, uh, which is, as I understand, used to cause you constipation, some rectal bleeding, and etc. So, what I would like to advise you now is to concentrate on your diet, that it should be full of fibers. It should be also you should control your fluid intake. You should drink a lot of fluids. That will facilitate your intestinal habit. And then I would like to inform you that uh,
Hmm.
purgatives are not the solution always. You will have to seek for natural alternatives for them.
Hmm. Yeah.
Am I being clear
Well,
to you?
yeah, doctor, that's clear. But can I just do something to prevent it from recurrence?
Yes, of course. As I told you,
Mm.
first of all, you will have to modify your diet. Again, you have been prescribed a regime of antibiotics. You
Mm.
have that. Did you start on antibiotic or not yet?
Yeah, and I don't know why they gave me antibiotics. I don't know how would it help.
Yeah. Antibiotics are the main treatment for bacterial infection, and bacterial
Mm.
infection is the main cause that will cause the inflammation in your colon, and that will lead to the diverticular disease that you were diagnosed and admitted for. So this is the prevention way. You will have to take the antibiotic in as prescribed, and again, as I told you, this is mainly relying on your way of dealing with your diet and with your life. You will have to improve your lifestyle to to avoid getting in this diverticular disease again. Am I being
Mm.
clear?
Yes, doctor. So, I'm just while you're explaining to me that my mind went away to the situation that I've been through, and how it was hard for me to deal with it, and how it was hard for me also to take it. It was a very frightening experience, and I don't know how to control my anxiety.
Oh, I'm so sorry to hear that. I'm here to assure you that many people pass through this condition, and it's not a really dangerous one. You have to know that you have passed the hard phase, and now you are dealing with just the treatment phase. As I told you, if you follow the plan, you shall be good. And I have a cousin that passed the same problem, and she's doing very well now after she followed all the doctor advice. It will take some time for you to modify your lifestyle, but eventually you will make it, and I'm sure of that, Yusra.
Hmm.
Um,
Okay.
Finally, I have few advices, let's say red flags for you to consider while the treatment phase. If you have any rectal bleeding or any bad abnormal abdominal pain that you have experienced before, or even worse, you should
Mm,
immediately seek help in the clinic and come back to us.
mm.
Because at that phase, we may consider having colonoscopy to, uh, to diagnose more about this situation.
Okay,
But
doctor.
but
I
until
would
now,
do that. But is my condition so serious for to the extent that I would undergo a colonoscopy?
no, the colonoscopy is not advised to be done now. It's just as I told you, if you notice another bleeding, another abdominal pain, another bowel habit alters, like a very, very, very strong constipation or diarrhea, that will lead us to think about the next step. But for now, your condition is very stable. You are in good hands and you have been dealt with very good. You should just follow your antibiotic regime, and my advice is about your diet modification, and you will be you will be in good condition very soon.
Yeah, thanks, doctor. Appreciate your help.
You're welcome. Do you have any other question, dear?
No, thanks. Thank you.
Okay. Have a nice day.
طيب بيرفكت يا دكتور نيروز، طبعا معلش غلست عليكي شوية.
No,
آه...
take your
في حاجات ما كانتش في الكارد بس انتي dealt with it يعني very good. we talking about dealt with it, it's you've dealt with it not you've been dealt with it. عشان
time.
we've been dealt with it معناها ان انا اللي اتظبطت. حد ظبط مش انا اللي
I
ظبطت.
have used weird tenses.
yes. بس هي كانت بس يعني بس فاللي هو انا وقفتك عند حدك يعني you've been dealt with. تمام.
No,
اه ميرسي قوي يعني.
there were any weak points
لا
besides
يعني هي بس حاجات من كده. طبعا
myself.
البوينت الاولانيه لو كنا رجعنا فيها او هنوقف الانترلوكتور في during الكارد نساله او هنقف شويه
No,
ان
I
احنا
did that
to make
because
it up.
because you are
بس لا لا في انا بنبه بس لان في ناس فعلا بتعمل كده. مش والله مش بألف يعني. في ناس
no,
فعلا
no,
بتعمل كده.
صح
او
صح.
حتى لو انت مش هتسالي الانترلوكتور بيقفوا يقعدوا يفكروا ايه ده، انا ايه اللي انا عملته، في حاجات بقى كتير going through my mind وده بيعد وقت معايا. فخلاص انا عملت حاجه غلط، خلاص اللي راح وبنبتدي ان احنا to start over again and to do our best in controlling the rest of the information and يعني in dealing with it the way it should be dealt with, otherwise هنخسر درجات. عندي بس هي advice مش advices، few advice أو few pieces of advice، مفيش مشاكل. ما عنديش أي مشاكل في أي حاجة تاني إلا بس to show more sympathy، وأنتي عملتيها في الآخر لما قلتي له I have a cousin that blah blah blah.
Okay.
فدايما بس before I start responding to the patient I have to show empathy. يعني أنا قاعدة أقول لك أنا frightened وأنا خايفة وأنا كده you didn't show any empathy. ف you have to tell me oh I'm sorry to hear that. I know it was very painful, of course it's such a painful experience, however we will do our best to prevent it from recurrent again from the recurrence وهكذا يعني.
Okay.
تمام. بس
تمام. Thank you. Thank you.
بس
ميرسي
very
خالص.
well.
Thank you.
تحت أمرك.